Obviously, there's been a lot of emotion in the COVID debate from the beginning, and that's entirely understandable. People have been understandably anxious about both the disease itself and the damaging effect of restrictions. With respect to the announcement made by Dr. Hinshaw last week, this is something that she and her team in the public health branch of the Department of Health, all of them professional members of the Permanent Public Service, developed over some time, presented it to our COVID Cabinet Committee, I believe on July the 8th, and we accepted without modification the proposal that came forward from the Chief Medical Officer of Health, which is based on science and data, particularly on the powerful science and data behind the protective effect of the vaccines, which has, as she says, dramatically changed the context of COVID-19. So to quote Dr. Hinshaw herself, she said, quote, I care deeply about the health of all Albertans. This means I have to constantly consider not just COVID-19, but all of the other threats to people's health. The majority of our public health resources have been directed to the COVID-19 response, as has been necessary. That has come at the cost of not fully working on other threats, like, for example, opioid deaths. As vaccine coverage has changed the nature of the province-wide risk of COVID-19, it is, in my opinion, time to shift from province-wide extraordinary measures to more targeted and local measures. This allows us to start looking at other issues while still continuing COVID-19 protective measures. So again, this was a package of measures that came forward from the Chief Medical Officer and her team. We respect their data-driven scientific advice, and that's why we accepted the advice. And it's important to highlight that the risks for children posed by COVID-19 are extremely low. They are lower than for the typical annual flu. As Dr. Hinshaw pointed out, for kids, we saw more children hospitalized in intensive care over the 7-month flu season of 2019-2020 than we have through the 17 months of COVID-19. She also points out that kids aged 5 to 14, had a 140 times greater risk of an emergency department visit for a sports-related injury in 2019 than their risk of COVID-related hospital admission since March of 2020. So we don't talk about shutting down kids' sports because, unfortunately, some kids get injured and have to go to the emergency ward. A tiny fraction of that number end up having to visit a hospital with COVID-19. I think it's also important. There's been some, I think, let me just be charitable and say inaccurate information that has about the impact of COVID on kids. It's important to recall that in Alberta, over the 17 months of the disease here, we have not recorded a single COVID-related death for any Albertan under the age of 20. And the vaccine coverage just reduces the chances of children becoming sick or experiencing severe symptoms radically from where we were 6 and 12 months ago. Well, I think it's regrettable that we've seen comments attacking the expertise of our brilliant Chief Medical Officer of Health. I do recall a time not that long ago when the same mayor wore a T-shirt saying, "What would Hinshaw do?" Well, what she would do is the policy of the Government of Alberta. This was a package that came forward from the Chief Medical Officer of Health and her team based on the evidence, both here and around the world, of the changing nature of the disease given widespread vaccine protection, and a careful analysis of the risks and benefits of extraordinary, almost unprecedented government intervention versus the diminishing risk posed by the virus given the powerful effect of the vaccines. So I guess I would say that this is a government that respects the advice of our scientific experts, of our Chief Medical Officer of Health, that is following that advice, knowing that that advice is based on hard data and science. And I would just encourage others in positions of authority. I can understand that from time to time there's going to be disagreements about aspects of policy, but I would call on anybody in a position of authority, especially elected leadership, to show a degree of respect for the Chief Medical Officer of Health and for the advice that she provides. Well, I'll tell you what the views of the Chief Medical Officer are, and as endorsed by the government, and that is to lift the mask mandate for ride shares, transit, and taxis in mid-August when we reach to the next stage. That's the advice that we have received based on the widespread protection of the vaccines. And I would encourage municipal councillors to respect the expert advice of the Chief Medical Officer. I don't know how a city councillor believes that they have a greater insight into the public health challenge than the Chief Medical Officer of Health and the Public Health Division of the Government of Alberta, who is responsible for this work. So I think we should focus on the science and not allow these issues to be politicized. I would point out, Rick, that the same councillor is somebody who didn't want to lift the mask mandate in Calgary whatsoever, and was ultimately defeated. So I know that there are some people who, look, I respect if there are individuals who feel that in certain contexts it makes sense for them to wear masks, that's fine. I respect their choice. And we do call upon people certainly to mask themselves if they are in a high-risk context, like a continuing care facility or a hospital, obviously. But the advice of our public health experts is that outside of those contexts, masking is no longer a necessary, or rather, it's no longer a necessary public health intervention. And look, the science is very clear. We have one of the highest levels of vaccination in the world. And let me just drill down on that a little bit, because it seems to get lost in all of the political noise. But the data out of the United States is remarkable. They have 163 million vaccinated individuals, fully vaccinated, of whom 6,600 are in hospital. That's 0.004% of Americans who are fully vaccinated are in hospital, and 3/4 of them are very elderly. In terms of people who get symptomatic infections in the United States, out of the 163 million fully vaccinated people, 0.09% end up being symptomatic, and those are almost always minor symptoms. Now, we have 2/3, and I believe we'll shortly, within foreseeable future, we'll have 3/4 of this population fully vaccinated, meaning that effectively COVID does not pose a risk for 99.999% of that population. It's time to follow the data. It's time to listen to the science.